discussions this morning, there was a whole lot of emphasis on health services research. And my comment was really meant to say that health services research, while it is an important component of research, really needs to be considered as one of several buckets that are important for the PA profession to be focusing in on. There are other buckets such as clinical research, educational research, health services research, and other kinds of areas that were not discussed as robustly as health services research.
And are you hoping that, based on some of the later discussions that went on within the smaller groups, are you hoping that some of those areas may be addressed, maybe tomorrow in the summit?
I certainly am. I'm eager to see how these topics will be parsed out in the breakout groups. You know, I think it really is important for us to move from a process research to an outcome research activity.
Can you give me a little more detail on what you mean by that?
Well, you know, a process research really talks about looking at how we do things, as opposed to outcomes research, which really looks at how effective we have been in doing something, how we have taken the process and have improved the health of society, of our nation, of our community, and ultimately of an individual.
And how do you think that would help us as we kind of enter into these healthcare reform discussions and PAs become a part of that?
Well, I think what's really important is we as a PA profession know that we do good things. The question is, do we have the data to validate that we are doing good things? And that is the challenge that we face right now, because in our healthcare reform environment, it is definitely going to be very data-driven. And without data, without evidence, we're going to be left behind.